We're back.
We're back.
In a cuter, backgrounded area. And I need to look at here and not here.
It's my room, our room, my house this time. So yeah, she just got out of work. It's closer for her, you know. It just.
I hope
makes
I'm
more
not
sense.
dirty.
No, I think you're fine.
I did.
I think you're fine.
I have some of Julie's dog's drool on me, but that's okay.
I mean, I have hair and stuff, so that's gonna happen. But anyway, yeah, she's having cafecito. I'm having some wine, so we're
2 different levels right now. Yvette trying to stay alive. Julie's still trying to stay alive. Okay.
Yeah. So today we decided that we're going to go ahead and talk about breast cancer because this episode comes out right in the beginning of October. So we're like, you know what? It's breast cancer awareness. Let's,
Free the tatas. I love that. I love that
know. And I
slogan.
love the little the bands that say that, like I love boobs or something like that. Like
Boobies.
it's awesome. So don't worry, it's not gonna be like a TED talk or anything like that. We're gonna just bring it up to, give you guys that.
Yeah, this
that
episode is more
information.
for awareness. I know it's funny medicine. By no means is breast cancer funny.
No, not at all. It's funny because we're funny.
Yeah.
That's why it's funny medicine, because we're funny.
Yeah. But we're doing it more to bring awareness to the episode and stuff like that. Not to the
Exactly.
episode. I can't talk right now. I'm out of work.
I mean, you just got out of work.
Awareness to breast cancer for Breast Cancer Awareness Month.
Exactly. So that's what we're gonna do. And if you're a female and you have boobies, even if you're a man,
Men get breast cancer.
exactly, you gotta get that stuff checked out. You gotta do the self exams and
Yes.
all that stuff. Talk
Yes.
to a doctor if you do feel something that's not kosher, that's not the usual. So yeah, all right. So what's breast cancer? So it's a type of cancer, right?
So it is a type of cancer. There's different types of breast cancer within that category, but usually it is cancer of the breast tissue. And then depending on where the cancer is in the specific location of the tissue, how it comes up, different hormones, different things can cause breast cancer. And but yeah, it's basically cancer in the breast tissue and can potentially be metastatic, which means spread.
It spreads. Okay. So
Yeah.
it spreads outside of the breast
Outside
to
of
like
the breast.
another organ around
Exactly.
or something like that. Okay.
Yeah.
Okay. Yeah. So does there have anything to do with the milk, like breast milk or anything like that? For instance, can it start like in the milk ducts or something like that?
Yeah. So in breast
Just
tissue,
because we were talking about breastfeeding not too long ago, and then now we're
Yes.
bringing this up, so it's like kind of like, I don't know, it kind of jives.
yeah, so breastfeeding has been shown to lower the incidence
Okay.
of breast cancer. Different things lower the incidence of breast cancer. Pregnancy is one of them. It's pretty much a lot of the breast cancers hormonal, like some hormones kind of drive the breast cancer. So that's why
Right.
they do a lot of that testing when you're initially diagnosed to see if there's any markers that can tell us a little bit more information. But yeah, so breastfeeding, it doesn't lead to breast cancer by any means.
Right.
You can even have some milk ducts that can become a little bit cystic and stuff like that.
Oh.
That doesn't lead you to a greater risk or pose you to a greater risk of breast cancer. But yeah, it can actually be protective.
Okay.
Yeah,
Awesome.
that's actually one of the reasons why we promote breastfeeding as well, because of the lower risk and the incidence of breast cancer in the
Gotcha.
individuals that breastfeed.
Gotcha. Okay. All right. So then we did briefly talk about like if it's metastatic, what is it? And that's that the cells grow and they multiply uncontrollably. So that's pretty much the case for any cancer. That's what the definition is. Like,
Yeah, unfortunately, breast cancer will start localized and then those cells start dividing and divide uncontrollably. And then everywhere in our body, we have lymph nodes. So if it gets outside to the lymph nodes, then that's how it's spread. So that's how it can become metastatic. So that's how it spreads.
Okay. Yeah. So because the body has like its own kind of like checks and balances, right? In where like it sees something that's abnormal, and then for example, one of these cells typically it'll take care of it, but then that's how cancer happens. Like it passes that, like it goes,
Yeah. So our cells are very smart, and this is like going down to a cellular level, which it's been a long time. But the best way that I can explain it is that our cells have a self-regulatory cycle. And if our cells see some sort of damage or mutation or something like that, then what's going to happen is that our self actually goes into auto like suicide.
Yeah.
And it kills itself,
Gotcha.
which is good. And we have
That's what stops cancer.
Exactly. That's what stops it. However, these are our own like cells
Yeah.
that are have this mutation. So it's not like whenever we have a bad cell, our body's, oh no, exit.
Yeah.
That's why we get sick and that's why
Right.
we develop cancers. So sometimes it is good at taking care of those things, and sometimes it can get a little bit out of control. It kind of like literally replicates uncontrollably to the point where it produces a cancer. And then that's why when we give chemotherapy takes care of the bad cells, but the good cells.
Right. It just does like a
So
whole blanket like on everything, because I mean it could be anything.
yeah, now we've advanced so much in medicine, which is truly incredible what we've been able to do, but there's a lot of targeted therapy now. So they'll do this hormone testing, they'll do genetic testing. So then they basically have these specific markers that will be on this type of cancer.
Yeah.
And then we have targeted therapy for
Amazing.
that specific cancer.
Amazing.
So yeah, it's pretty incredible the stuff that we've been able to advance with cancers in general.
Right.
And it along with breast cancer as well.
Okay.
I think the screening for breast cancer has also been like a big movement. I
Yeah.
think we didn't do it enough years ago.
Yeah.
And now we have the technology to do it even
And
more.
also the research showing that it's important.
Yes.
Too, like I think,
No,
you guys
yeah,
are really
definitely.
putting a lot of research and a lot of time into it. So
Yeah, the research into cancer is pretty incredible. But yeah, then there's cancer awareness for different types of cancers, but breast cancer is a really big one, and we got to get behind it.
yeah.
Yeah.
Yeah. We're getting better, but we got to keep on it, mostly with the preventative medicines, like you were saying, like
Yes.
the mammograms and everything that we're going to touch upon now.
So let's touch up on that because I have a little story and it's kind of crazy. But yeah, anyways.
Oof. Okay, so symptoms and diagnoses.
So the biggest symptom or the biggest thing that we watch out for with breast cancer is a lump in the breast. So that's why we push a lot for women to do self-exams, and it should be routine.
Yeah.
It's not that hard.
Yeah.
And it's
Do it
quick.
in the
You do it in the shower. You
your
do it
changing,
anywhere. You
whatever,
can
yeah.
literally be pooping
Yeah.
on the toilet
Yeah.
and do a self exam. Pain in the breast
Yeah.
too is another one. If you see anything with your breast, like dimples,
Different.
wrinkly in some point, your nipple starts to look different in color,
Nipple
in
discharge.
change, discharge,
Yeah.
anything like that.
Of course, if you're not breastfeeding, like just us right now that we're not breastfeeding or
We're
whatever,
not
all of a
doing-
sudden
yeah.
tomorrow morning I wake up with some discharge, red flag.
Yeah,
You know?
exactly. Like it's not rocket science. If you see anything abnormal with your breast,
Yeah.
then go and get it checked out.
Yeah.
Because the sooner you get diagnosed, the better
Yeah.
it is.
Mhm.
And the basically the less of a chance you give it to metastasize. So yes, unfortunately, sometimes you don't feel it. And then by the time that you feel it, it's a little bit more advanced. And that's an unfortunate situation, but that doesn't happen to everyone. What I try to always let my patients know is that what you're doing with the self exams as well is you're pretty much learning your own breasts.
Yeah.
So you know
Yeah.
what's normal compared to abnormal. If you've been doing your self breast exams or basically like checking yourself every single month for years, you're gonna know when
You're gonna
there's
know
something different.
More than
you know?
most people, yeah.
Yeah, because you've been doing it. You know what it feels like, what a difference feels like. And yes, things fluctuate. You can have cysts in the breast. You can have maybe hormonal changes that makes it a little bit more like lumpier or something like that. But you know that difference.
Exactly.
And it triggers you to be like, no, I need to go to the doctor.
Absolutely. Absolutely.
Fear is a huge thing too.
I'm sure.
Unfortunately, there's a lot of us out there that we go into like a denial phase.
Yeah.
You know?
Yeah.
And it's scary. Of
It
course
is.
it's scary. I cannot imagine that when I have my adolescents come in and they feel something weird, something off. I too, like everyone gets nervous around cancer. No
course.
one wants cancer.
Of course.
But you should always do your exams on yourself. And actually there's actually been talks about stopping recommending the self-exams.
Oh, okay.
Yes,
Maybe
I don't think that's been an official recommendation. I could be wrong. I'm gonna still continue to recommend it.
Yeah. I mean, maybe they recommend that for people that are prone to like high anxiety.
Yeah,
like,
obviously.
that
Yeah.
then they become hypochondriac about it.
Yeah.
Maybe if you're teetering around that, but like if you're just doing that as a normal everyday, it's just part of your routine, like
Yep.
while you shower. I know a lot of people that I bring up the shower because that's like, at least me and other people that I know, they're like, oh yeah, when I shower, I just, everything's kosher. Okay, cool. If you're like just in that routine, then I think it's fine. But
Yep.
maybe when it's, I don't know, they get scared because they encounter, oh yeah, that's my dog. Say hi. That's him. If you've heard
Oh no,
noises,
that's a pen. That's not yours.
if you've, yeah, great. So if you've heard noises and me getting up and whatever, it's because of this rat right here.
Yeah.
Anyway, yeah.
But yeah, it actually, there's a lot of physicians that recommend against it because of the high anxiety, and they come
That's
back
it,
and then
yeah.
it maybe
It's gotta be
leads to
that.
unnecessary testing. I'm always going to recommend an exam. Always. Because it doesn't mean that every time that someone comes in, as a doctor, we also, what? Do you like the way my bun tastes?
For people that are only listening in
Little
audio,
thing here.
it's my pup. He really wants attention. He's in here now because he couldn't be outside alone, and so he's like literally right behind us on the camera. But anyway, continue. Sorry.
But anyways, I'm always going to recommend it. And as a doctor, you also need to have that open conversation with your patients and say, I prefer that you come to me with any doubts.
Yeah.
And I'm never going to be like, stop touching because they're
agree.
anxious.
Yeah.
Never.
I
The
agree
last
with
thing
that,
I
yeah.
want is for someone to come to me
Exactly.
and say, you told me not to do it, and then think it. Nope.
Yeah. No.
I'd rather you come to me.
I definitely am a proponent for self-examinations because, I mean, again, you had said it. You're the person that knows yourself the most. You live with your breasts. They're part of your body. Like, you know if something's off, something's
Yeah.
different, something's like not supposed to be there. It hasn't been there. It wasn't there like last week or whatever. So
Yeah.
it just makes sense.
Yeah.
But yeah, so if you experience any of those symptoms, like, please seek medical attention. Like,
Yeah.
go talk to you. Who do you think? Like your OB guy?
Go to your primary care physician.
I mean, why not?
We literally go to the urgent care for the stupid shit.
I know. So why are you not gonna go
For something that
something that can be that serious?
Yeah, exactly.
You know. So yeah,
and we're not trying, please, for the love of God,
No,
like,
no,
we're
no,
not trying to instill anxiety in anyone
No,
here.
it-
We're just saying, if you have any questions, if you have any concerns, we recommend you just go and follow up. So your primary care physician should be trained to do this. Okay.
Right.
We are trained in medical school and during residency to do these breast exams, to do the labs, to do the ultrasounds, to do other sorts of imaging to make sure that you don't that this is not a breast cancer situation.
Right.
So there are people, I'm not going to say that every primary care doctor is made equally. There are physicians that will refer out to a specialist. However, I think that is a disservice, okay? Because sometimes it takes a really long time to get to these specialists, and that's just wasting time.
Right.
Okay. So go to your PCP. They will do hopefully the initial workup while we wait to see a specialist. And that could be a breast surgeon, that could be maybe an OB-GYN.
Right. Because I know that, like, when I go to, let's say, my annual, when I get my PAP and all that stuff, which I know that the recommendations have changed also for the PAP, but that's a whole different tangent.
Yeah.
I know that she routinely, at least, does like a lump check, like just hand, you know, just over, whatever. So,
Which I
but-
think that's great.
yeah. So, I mean, just see your OB. You're gonna see her anyways.
Yeah.
Or him, whoever it is.
Yeah,
Like,
and
you're gonna-
even for those of you that are maybe still in college or something, your health, your student health has practitioners and stuff like that that will also do that. So
Yeah.
go and get checked.
Exactly. That's why you have, you just do it. So how do we diagnose it? Now that, like, let's say there is something suspicious, you went to the doctor, there's something there that's not kosher, like,
Yeah. So if there's a high suspicion for a breast cancer, then usually we do blood work and then we also do imaging. And then the imaging will sometimes depend on your age just because the density. So I'm just going to say the density. I think that's like the best word to explain it. But the density in your breast is different for every age group. So depending on your age group or the exam that we do, we might have you do an ultrasound or we might have you do a mammogram, MRI,
Yeah.
those type of things.
Okay. So typically mammograms, they're highly recommended after 40.
Yes. So after 40, every other year, you should be getting a mammogram.
Okay.
You can have it younger. So just because you're not 40 doesn't mean that we're not going to do a mammogram on you. So I think that's a very common misconception. But after the age of 40, that is where the incidence tends to be higher in breast cancer, which is crazy to me because I'm 34 and I can't believe that it's
Yeah, so am I. Yeah, that we're approaching that age
we're
of
approaching
like
that age. It's like this recommendation, whatever. That's like crazy to me, mind blowing. But moving on. But yes, and then before that, it is optional. So I don't know why it's like after the age of 40. Yes, I understand medicine. Okay, got it. All right, I'm like I can see already like 1,000 people screaming at me for saying that sentence. But I just think that early detection or routine screening earlier, I think there's more research that needs to be done in order for these recommendations to be pushed to be a little bit earlier, maybe as young as 35.
Right.
Because we see a ton of breast cancer
I agree. I'm surprised
and
it's
the
not at
20s
35.
and early 30s. So, yes, I understand. The majority is after the age of 40. I understand. I think it should be routinely or at least offered,
Right.
you know?
Right.
But then you get to the whole entire insurance. Is it going to pay for it? Is it not? And, you know, I'm not Kim Kardashian getting a whole entire full body scan.
Go see our Patreon episode.
Yeah, go see our Patreon episode on that. But basically, one of my close friends works for a company that part of their employee wellness was to bring in a mammogram machine.
Okay.
And women had the option to go ahead and get screened, which is
Phenomenal.
Like we see all these like wellness things, and I think wellness has been a huge push in the last few years for every place. But it's usually like, oh, like cocktail hour here, or maybe like a little gift card to, I don't know, Chick-fil-A. I don't know, something like that.
Yeah.
And then I was like, wow, like that is genius. Like bring in a
actual
mammogram.
wellness.
Yes, because, or like maybe like they say like, oh, well, you have one dedicated day to go to the doctor.
Right.
So they give you that day off, but it's a paid day off.
Right.
Whatever.
Right.
Point is that they brought in a mammogram machine. And this person was not the age where you usually get routine screening. They did the mammogram, and I mean, unfortunately, they found breast cancer.
Oh my God.
Yes.
Thank goodness for that.
Isn't that crazy? So they found breast cancer, and she didn't have a lump. She didn't have anything. But they were able to do a lumpectomy and
that's it. And
I think she got like some radiation, and that's it.
That's incredible. And that shows you the power of preventative medicine.
So it's like unfortunately, but fortunately,
yeah.
it's like
Incredible. Yeah, that's actual wellness.
Yeah, that is wellness. that is wellness.
Absolutely.
But I just thought it was so cool, you know, like for free.
Incredible. I love that. I love that idea. Whoever came up with that idea,
came up with that
phenomenal.
Deserves a golden.
Well, he or she, whoever it is that came up with that idea, saved their life.
Yep, it literally could have potentially.
Potentially, like
you
depending
never
on
know.
the stage.
Yeah, you never know. Yeah, exactly. I don't know the specifics about.
Of course not. You never know, and thank God. And thank God you don't know. You don't want to know how far along it would have gone by the time that a lump would have been felt or something, anything. You know, incredible. But anyway.
I'm not saying a mammogram is the most comfortable thing either.
Oh, it's not. Yeah.
I've heard. I have not had a mammogram done before, but I've seen them, and they squish your titties into a pancake. I didn't even know that they could be that flat. Yeah. It's so, I'm like, oh.
If you guys are on Patreon, you see like just the video. Anyway, so what we said, mammograms, MRIs, ultrasounds,
biopsy, right? So if we do find something, they will take a biopsy, and they'll even do tests to see if the lymph nodes around the breast are also have the cancer cells. So that'll give us a little bit of more information on potential staging. Because you definitely want to stage every type of cancer to see where you're at.
And it kind of like curtails like what type of surgery then you need.
Oh, what type of surgery, what type of treatment, how aggressive they need to be. Staging is super, super important. You pretty much can't proceed like to treatments or you can, but you need to stage where you are.
Okay. All right. So then treatment options. we just said surgery. Then
Yeah.
there's also, like you had mentioned briefly before, radiation and chemo.
Yes.
Okay. And then chemotherapy, as you had said with radiation as well earlier, that it's pretty much all of the cells. It's not, at least right now, when it comes to radiation and chemotherapy, traditional, it's just like all of it. Hence why you get all those horrible side effects that you see, like the hair loss is a big one.
Yeah.
Unfortunately, it's particularly like sensitive for women for obvious reasons. And then you
Which
have
all
like
power to females now, like rocking the no hair look.
amazing.
Yeah. And honestly, wigs, they've come
Yeah, a long
so
way.
far. Yeah.
A long way. They're beautiful now.
They're beautiful now.
Like you can't even tell.
You cannot tell.
Yeah.
Yeah.
And then-
Listen, have you ever been to like a breast cancer?
I've walked by one in the Baptist. So
Yeah.
Baptist down here in South Florida, by the way, Baptist is a big like hospital chain per se.
Yeah.
And in their cancer like building,
Yeah, their new one. It's
in
beautiful.
their new then they have a store that's with wigs. And it's beautiful and it's a great idea. I'm glad that they did it. You
Yeah,
know? So
I've
I
never
walked by
seen it.
it, but I haven't gotten.
Well,
but
there's
yeah.
a ton of people like at walks and
Yeah.
like breast cancer events that they shave their head. If you like don't, they like literally separate their hairs and they're like, for every so much, I'll shave off a lock of hair.
Wow.
Yeah.
Wow. But yeah. So yeah, radiation and chemotherapy, they do have like nasty, horrible side effects, but it is definitely necessary. Especially depending on the type of staging that you are and how far it's metastasized or whatnot. And that's why you get these horrible symptoms and these side effects, because you go, it's a global, like it's not only targeted to that cancer cell, but it's pretty much all your cells.
Yeah.
It's obliterating and pretty much all of them. That's why you also have the weight loss and so many things.
Yeah.
Like there's just so many things. Then there's also hormonal therapy to block the effects of the hormones if it is a breast cancer that is triggered and caused by the
A lot of our
hormones.
chemotherapy are like hormone, like hormone targeted therapies.
So yeah, that's pretty much the treatment options other than surgery, of course. And then, so the common side effects of it, like we were talking about, you got the fatigue, the nausea, the vomiting, which is one of the, I think pretty much almost everybody has a nausea and vomiting.
I mean, these chemotherapies are very intense and they're given in cycles.
Yeah.
So, like a cycle could be like every day.
Yeah.
A cycle can be like Monday, Wednesday, Friday. It just depends. These cycles are like really tough, and you take the first one and you're like, okay. And then you take the second one and you're like, starting to feel it. And then by the next day, you're like down. But it's crazy how people like they have this resilience
Absolutely.
in them, and it's
The
incredible what
motivation.
humans can do
Yeah.
and what humans can take.
Yep.
So
Yep. With the motivation
power
and the
to them.
determination to push through. So yeah, it's important. Like the mental game is a big component
it's huge.
into all of it.
And I
as
think
well.
our teams, our medical teams, and by teams I mean everyone, like
Yeah.
the physician, the nurses taking care of
Everything.
them, everyone, the social workers, everyone, the families, the patient, everyone working together and like really rooting for our patients is what allows them to be pushed further.
Absolutely. I've heard stories because I'm sure breast cancer is unfortunately very common to the point that like I have friends and even family members that have had breast cancer or unfortunately have passed away from it or whatnot. And you hear the stories of, when I was getting my treatment, such and such nurse or such and such aide, all this bunch of stuff, like they were so cooperative, they were so helpful, they were there for me, they talked to
They
me.
remember
You know,
everything. It's a big impact.
Everything. It's huge because you're in such a vulnerable position and in such a vulnerable stage in your life right
Very
there.
scary.
It's so, you're scared, you're vulnerable, you're just everything. Your whole thought of what your future might be is crumbling.
Your life can change from one second to the next.
And then you have just somebody being kind to you at that moment that you're that fragile. It means the world. It really does. So survivorship. So it all depends pretty much on your staging, right? Yeah.
Oh, it depends. Everyone is different.
And every body.
Every body, everyone, every cancer, like everyone it is
There's a lot to it.
very different. Yeah. So one person can be a very different journey from another person. So it's very personal to that person, which I think now medicine is able to be more personalized. But yeah, survivorship it depends on the cancer. It depends on how much it's progressed.
Yeah.
It depends how you respond to initial treatments. It depends if you're on a research study, if you're not. Like there's so many factors that go into that. But if
Right.
there's one thing that I I speak for a lot of people
Yep.
is that everyone is on the same boat for survivorship.
Absolutely.
So,
Absolutely. Yeah, it's just, it's important for everyone, you know?
yeah.
So just to close off the episode, I'm going to go ahead and, of course, source everything, all the images that I'll be posting in our socials in regard to breast cancer. I found some, I mean, there's unlimited amount of resources online about breast cancer.
Yeah.
There's incredible organizations out there.
Yeah.
Everybody's done a great job at it. So
Yeah.
I'll be posting those photos with those sources as well. And like from the National Breast Cancer Foundation Inc., they stated this year in 2023, 2,800 men. Okay, so this is not only women, okay? 2,800 men will be diagnosed with breast cancer in the United States, and approximately 530 will die. So just because you're a male,
Yeah.
you're a man, and doesn't mean you shouldn't be checking yourself for this. You shouldn't be, you know, concerned about it. You equally should
Yes. Male
checking
men
yourself.
have breast tissue.
Yeah, it's there.
It's there.
So you got to check. And then 1 in 8 women in the United States will develop breast cancer in her lifetime. So that's why it's important. Check. Stay
Check.
on top of yourself. Anything that's weird, don't just put it to the side. I don't have time. It's more important.
Yeah.
You're definitely not going to have the time later, you
Yeah.
know? So make the time for yourself. Make
Yeah.
the time for your health.
And one thing that we didn't mention here, but family history
Big time, yeah.
is huge. So
Yes.
if you have a family history of breast cancer or anyone with uterine cancer or anything like that, go and get checked, ask for testing. BRCA testing is huge.
Yes.
That's basically one of the mutations, just one, okay? But if you go and get tested, they usually test for other types of things that could be familial as well. And we didn't do this, and maybe it's something that we can do for the month of October, like maybe like a mini episode or something like that on preventative mastectomies,
Yes.
which
Yes.
is so like I'm
heard
so happy that
Celebrities doing it and stuff like that.
yes, and it's something that was not done before, and unfortunately, there's actually some insurance companies that won't cover it.
Of course.
So, but it is like a huge thing now, and I'm so happy that a lot of women are taking that step to having a double mastectomy and all of these things. And now there's even plastic surgeons that will actually go and do reconstructive
Yeah.
surgery to help them out and all. So it's just something that's like really beautiful and something that's advancing in medicine and things that we didn't think about before that we're now thinking. And it's huge to like go get tested and make the decision to remove a part of your body that has been with you forever, even if
Yeah.
you don't know you're going to get breast cancer, but it can save your life potentially, is a huge step. So that's something that we didn't really talk about because we didn't have enough time today to talk about it, but maybe something that we can do like a little mini episode. Maybe you guys can tell us if you want to hear more about it.
Of course. And it's just breast cancer is such a massive topic, you
Yeah,
know,
it is.
that we wanted to, of course, the whole point of like our podcast is that we want to have medicine be lighthearted enough for it to be approachable. We don't want it to become like this TED Talk type of situation
Yeah,
or
exactly.
whatnot. You know, we wanted to give you guys the information of how important it is to have you guys like be on top of your own bodies.
Yeah.
Go to the doctor. If you feel something weird, take the freaking half day off to go see the doctor or whatever it is. It's important, you know?
Yeah.
So,
We
but
call in sick for a hangover. You can call in sick for a checkup.
for a checkup. And better safe than sorry, especially when it comes to this type of diagnosis. So we wanted to, since it's Breast Cancer Awareness Month, we wanted to bring awareness to it. And a lot of you all that are listeners, you're female and you're even male. And look at what I just talked about right now. It's a big thing for men too, which is something that men just don't talk about because breast cancer is so related to female and it's such a woman. It's even pink, you know, and everything.
know.
And pink is very feminine and it's at least culturally and historically, whatever.
It is.
Pink has always been associated with girls.
Less sorry.
So that's why it's very tabooish for men to talk about, but you still need to check it out. Men, you're in the shower, give yourself a pat for a minute.
Yeah.
You know, like I just don't think that you're completely immune to it because unfortunately none of us are, you know? So
no one.
we wanted to bring awareness to it, and we'll see you guys for the next episodes. Check us out on Patreon, patreon.com/funny medicine podcast. Thank you all for the support on Patreon and on the tip jar. We really, really, really appreciate it. We're there on Patreon is where we talk about the more salacious, more juicy topics.
I love that word. Salacious.
We talk more, we let ourselves slide a little bit more because there's that paywall, so it's fun. And then you also see these episodes that are audio episodes in the weekly put in video. I mean, there's a lot more stuff in there, of course you'll be helping us out. And for the month of October, we have planned that we want to keep it spooky. So, it's Halloween coming up. So the next couple of episodes for the month of October, both weekly and on Patreon, on both sides, we're going to be talking, of course, as we always do on Patreon, we talk about different things than we talk on the weekly. It's not the same stuff.
They're not the same.
Not even remotely. Mm-hmm. The only thing that they're going to have in common is that it's all spooky stuff that we're going to be talking about.
Creepy shit.
Creepy medical stuff from here on out for the month of October. So check us out for the next coming episodes on both places, and we'll see you on the next one.
Bye.
See, I didn't do anything weird now.
I didn't even look at what you did.